What's it like to die in your own home? What does death really look like? And what happens immediately after someone dies? Hello, I'm Catherine Lightbourne, and in this second episode of our Treetops Hospice podcast, I'm talking to Tammy and Jade, two of our Treetops Healthcare Assistants. Tammy and Jade are part of a team of hospice at home nurses who provide end-of-life care for patients in their own homes. They talk about the differences between dying at home and in a hospital, their own experiences of caring for someone in their last few days of life, and what a good death looks like. If you would like more information about how we can help you or a loved one, head to treetops.org.uk. And please don't forget to share this podcast with others.
Hi, my name's Tammy.
Hi, my name's Jade.
Why is it important to families to have their loved one at home? Why aren't they choosing to perhaps go into hospital, would you say?
I think, especially with the pandemic, it's been more evident that obviously a lot of people died in hospital with no family around them. And I think it's more important now that they want to be with their family members. And the thing that scares people most about having their family members at home to die is the actual dying stages, because a lot of people haven't seen it or they've had bad experiences in the past. And I think it's important, especially if it's that patient's wish to die at home, because not all the time do the families want them there because they're worried or scared about it. But patients want to be at home in familiar surroundings with their loved ones around them, or their pets, or the things that they, recognise as theirs.
How would you say a death at home is different to a death in hospital? I mean, you've touched on it a little bit there about, particularly during the pandemic, but what do you think being able to die at home allows patients and families to perhaps experience that they wouldn't get in a hospital setting?
I'd probably say more relaxed, and it's more calm. They're in their own bed sheets, pillows, and to have all the family around them. Whereas in hospital, it's great service, but it's more fast-paced and clinical, and it's just a lot more going on, I would say.
And also as well, if they're in a hospital environment, they're generally not in a ward on their own, and they're all in a terminal ward. And whilst they're going through this process of dying, they're watching other people die around them. And they don't necessarily see it, but the curtains get drawn and people know what's going on behind there. And it's almost like, well, that's what's going to happen to me. When they're in their own home, it gives them they can have the music on that they want to have on. Yeah, they can visit, they can have people to visit, if they want to have a beer or a cigarette, because some people do smoke and some people just still do drink in the end of life. It allows them to do them things, and their emotional well-being is taken care of, and that their emotional and spiritual well-being is more taken care of at home than in a hospital setting.
There was a patient that I went to, and they was in hospital. All that patient wanted to see was his garden. So to be able to come home, which is what they managed to do, to be able to come home and then him be in his hospital bed with all the aids around him that he needs, equipment, to be able to see his bedroom, his spirit picked up. He knew obviously he was dying, but he picked up with his spirit because he could see his beautiful views.
Yeah, lots of people pick up, don't they, when they come out of hospital?
Yeah.
And I suppose one of the biggest fears about being in hospital is your family can't be there 24/7 as much as they want to be. They physically can't be, and then sometimes not allowed. So being at home allows them to be around them as much as they can be. I think it's important for both of them, for the family and for the patient.
Yeah.
You must have patients that don't have much family, or family that don't live nearby. Do you find that that's a different kind of experience at all? Have you had any families like that, any patients like that?
Yeah, I have. I think when someone's on their own or they've not got a lot of family, it's more important for them to have someone with them because they've got no one to talk to. And I've been in a situation where someone said to me, "You're the first person I've spoke to since the last nurse left this morning." And things change so rapidly at end of life. Someone can be walking about and making their own meals in the morning, and by night time they've gone downhill to the point that they're bedridden. And suddenly they've got all these questions and they don't know when the next person's walking through the door. So to know that they've got support coming in. And I think some of the scariest times people who live on their own is night time, because that's when the thoughts go through. So when we're there for the support calls, But now we've introduced the roaming service as well. I'll always say to patients, if you've not got a support call throughout the night, you pick up that phone and you speak to roaming service. We're not just there to visit. We can speak to you on the end of the phone and reassure you. And if you need us to come out, even if you don't need us to do anything, you just need us to be there for you, then we're there.
That's the support I would give. That's what I give to my patients if they are on their own. I had somebody not long back they had family that was like close by, to be fair, and he was okay one minute, but then the next minute he had just rapidly gone downhill and bedbound, and for them it was really hard and scary. So for that support, it helped them a lot, and to know that roaming was there, and when they come out, it really reassured them.
Do you think people understand they have the option to die at home? Because it's not something that's sometimes talked about to patients at end of life.
I think they would rather die at home, but it's sometimes finding the support and the families getting the support that they need.
Do you think patients are scared of dying at home for any reason? Are there any barriers or things?
I think it's more the family that are more fearful of their loved ones dying at home. I think a lot of people, if you actually speak to them, they want to die at home and be with the people that they love and care for. But the family are so scared of the whole dying process, and like Jade said, the support network isn't always there. There's a lot of people that are in hospital and they're told they can't come out of hospital because they can't get a care package in place. And that's where sometimes patients have failed, because they can't get to be where they want to be, but also because the conversations, a lot of families don't want to talk about death and dying.
It's hard.
Yeah, it's a difficult conversation to have with anybody, but when it's someone you love. But then if you actually sit down and talk to people, I'd say the majority of people want to die at home.
People are very curious about, what does death look like? What can death look like?
It's very different for every patient.
It is different.
Yeah.
You can get some patients that don't talk about, obviously, the dying process. To be fair, majority of patients don't talk about that. But you can get some that are really in the self, and it's you that's having to bring their spirit out and get that bond between you and the patient. Or there's some patients that everything you do, they are so thankful for, and they're trying to keep you happy and smiling. Not like you're not anyway, but they're trying to keep that spirit there, and putting all their effort into keeping the atmosphere amazing, even though it's such a sad time and it's hard.
Are you actually asking what it looks like as like looking at a patient who is dying, the situation? Because I think 90% of the time, a patient that is actively dying in their last sort of hours is very peaceful, but to get to that process can be quite an emotional journey, because there is anxiety, there is restlessness and agitation, and that's why the drugs that are given when someone is very end of life, they are all there to manage those symptoms. And families think, oh, they're agitated, they need this drug, and it doesn't always work. So they think that once they've received that drug, that family member's going to be fine. And sometimes it takes a little while for those drugs to build up a level that manages those symptoms. And so the symptom side of things can be really quite distressing for a family. And that's when I think one of the most important times for a support call, because that's when they need lots of reassurance, when their family member's in pain, because they can be in pain, they can be restless, they can be agitated. And that's then when we step in and say, this is just part of the process, because a lot of families are very reluctant to start the drugs because they think that that's them saying that's the end, which unfortunately it generally is. But we have to explain to them, then that's the difficult part of our job, is trying to explain to family that these drugs are there to manage these symptoms, to manage their pain and their agitation. And although, yes, sometimes it is because it's inevitable and it's very, very soon, it's important for them to realise that actually it's not about them now. It's about keeping that person comfortable and as pain-free and as calm as possible, so that their end can be as peaceful for both of them. But 90% of the time it's peaceful and it's nice, and the family get that time to sit around the bed and hold hands with their loved one, and it's just that moment of peace and just like surrounded by love. But to get to that, sometimes it's a difficult journey, and that's where we're really important, because it's really important then that we can say to them, why don't you go and have a cup of tea? We'll get them settled, we'll call the roaming service, and we'll get them the drugs that they need, and then you go and have half an hour to yourself. And then they come back in and they see that they're calm and they're relaxed, and they'll quite often they'll say, why didn't we let them have the drugs sooner? Because that's the acceptance that their loved one is actively dying, and unfortunately that's something people don't want to accept. But then it's really important that they realise that it's symptom management and it's needed.
What actually happens when somebody dies at home? What are the steps that need to be taken?
The family will be called. We will use our roaming service, or if they're busy with another patient and they can't get to us in time, we would use 111, and they would come out to verify. So once the verification's been done, it's in the family's own time, no rush for the undertakers to come. Whether they want to do that themselves or we take over and do that, because that's what we're here for, to take the pressure off the family in every way that we can possible. And then we do the last offices where we will wash and dress the family member, but sometimes the family will want to help as well because it's their loved one, or they will want to do it, not necessarily you do it, they will probably want to do it. So it's just making the atmosphere is sometimes really tense, but you just get on with it and you try and make it as calm and as smooth as it can be. And sometimes the families will sit there with their loved ones, and sometimes it needs you to probably say, if they put some of their favourite songs on that they would probably like. So it's just about making it really calm and speak to the families and give them all the support and just make the patient look as presentable and lovely as you can.
Yeah, I think one of the biggest fears of the family is that they'll go home and they'll get some rest, or they'll go upstairs and they'll get some rest, and the person will pass away without them being there. So obviously for us, we're not psychic, we don't know when it's going to happen, but there are certain signs that we can look for, and when those signs start to happen, if the family aren't there, or if they're upstairs or if they're at home, our first thing would be to call them and say, this is happening. Some families want to be there and some families don't. Yeah. And in that instance, it's a reassurance that, well, we're going to be with them and we're going to hold the hand and we're going to talk to them, and when they pass, we'll give you a call. Some families, of course, want to be there and they want to be, and I will stand back and just sort of say, tell them what you want them to know. Tell them that you love them. Tell them anything right now. Tell them anything you want them to take with them. And we always say, and no one knows, but we always say the hearing is the last thing to go. And so that's why I'm always, make sure you tell them that you love them. Tell them any information that you want them to know. Tell them now. And then obviously when they go, it's a case of just giving them a few minutes to just sort of process what's going on. And then we do everything in the family's time. Like Jade said, the things that we do, it's all when they're ready. We have to make that phone call to get it verified. But we explain to them, once the verification's taking place, there's absolutely no rush to do anything of the next stages at all. If they don't want us to touch the family, that's my family member, that's absolutely fine. We don't need to, but it's all down to them. But like Jade said, we just keep it calm, and sometimes they need lots of emotional support. Sometimes there's family that's emotional. Sometimes there's family that's angry. And then it's about being there for both sides, because being aware that some of the family's very tearful and very upset. And then there's an angry family member, and it's, there's no point in trying to calm down an angry person. We don't know them. They would be quite resentful towards us trying to do so. So it's about keeping the environment calm.